Hello there, and welcome. If you're hoping to get a clearer picture of the different medications out there for ADHD, you are in exactly the right place. We're going to walk through the main options together so you can feel more informed and ready for any conversation about your health. So, let's dive right in.
So, here are some medications that I would like you to know about as you navigate your health. We're going to start with the first and probably most well-known family of medications, the stimulants.
All right. First up, we have the amphetamine family. These are stimulants, and they're one of the most common and effective ways to treat ADHD. Basically, they work by giving a boost to a couple of key chemicals in your brain, dopamine and norepinephrine. You can think of them as messengers that help you focus and pay attention. These meds just help them do their job a little better. Now, you've probably heard of some of these names before, like Adderall or Vyvanse, right? What's really helpful here is seeing the brand names right next to their generic names. This is super useful because, depending on your prescription, you might see one or the other, but it's good to know they're the same core medication. Okay, so let's break this down because this is where it gets really practical. Take a look at that typical duration column. You see how something like Adderall comes in an IR or immediate release version that lasts maybe 4 to 6 hours? But there's also an XR, extended release, that can get you through a whole workday. Vyvanse can last even longer. This variety is a big deal because it means your treatment can be tailored to fit your schedule. And then over on the right, you'll see some common side effects. It's so important to know what to watch for, like a lower appetite or trouble sleeping, so you can talk about your experience.
Next up, we have the other major stimulant family, the methylphenidates. Now, these also work on dopamine and norepinephrine to help with focus, but, and this is the key part, they do it in a slightly different way. And this is so important because it's why, if one family of stimulants doesn't quite work for you, the other one still might be a fantastic fit.
In this family, you'll find some really well-known names like Ritalin and Concerta, and what's interesting here is the different ways you can take them. For instance, Strattera is actually a patch you wear on your skin. For some folks, not having to swallow a pill can be a total game changer.
So when you look at this table, you're going to see a pretty similar story to the amphetamines. You've got your short-acting versions, like Ritalin IR, and your long-acting ones, like Concerta, to provide coverage all day. The side effects also look pretty familiar. Things like decreased appetite and headaches are common here too. The bottom line is that both of these stimulant families give you a whole range of options to try and match what you need.
So we've talked a lot about stimulants, but there is a whole other path we can take, and that's non-stimulants. And there are two really big differences to know about. First up, how fast they work. Stimulants get going quickly, usually within an hour. Non-stimulants are more of a slow burn. They build up in your system over a few weeks. The other thing is that stimulants are what's called a controlled substance, which just means there are stricter rules for prescriptions.
So let's jump into that non-stimulant family. These are a really important alternative, especially if stimulants cause side effects you don't like, or maybe they just aren't the best choice for you. They work differently in the brain to give you a really smooth, 24/7 kind of symptom control.
Here are some of the main non-stimulants you might talk about with your clinician. And as we're about to see, they all provide that long-lasting coverage, but they each have their own unique things to consider. Okay, check this out. You can see the duration on these is fantastic, right? Often full day or even 24-hour coverage. But now, look at the side effects. This is where things get a little different. While you might still see things like decreased appetite, you'll also notice that sedation or sleepiness is more common with some of these. Now, for some people, that might actually be a helpful side effect, especially if you also struggle with winding down at night. Phew, so we've covered 3 different families of medication. And that brings us to, honestly, the most important part of this whole conversation, figuring out what works for you. Treating ADHD is never, ever one size fits all. It's really a journey, a process of discovery that you and your clinician go on together. I absolutely love this quote. The real goal here isn't just to make symptoms go away. It's about finding that sweet spot, that balance, where the medication is helping your daily life feel better and run smoother without the side effects getting in the way. It's all about your overall quality of life.
So how do you find that balance? Well, this right here is your roadmap. You are the most important player on the team, so track how you feel, the good, the bad, all of it. Make little notes about any side effects you notice, and then, this is crucial, talk about it. Be open about what's working and what isn't. That feedback is pure gold for your clinician. It's exactly what they need to help you make adjustments.
And that leads us to our final thought. With all of this new information, I want to leave you with a question to chew on. What is the first question you're going to ask about your treatment plan?
Thinking about that ahead of time is one of the best things you can do to be an active partner in your own health journey. Thanks so much for your time.